Hello, Joel Dunning here at ESCS 2024. I'm here with the one and only Diego Gonzalez Rivas. And it's insanely difficult to get and grab an interview with you. Because just tell us, what have you done over the last few days? You've been relaxing on the beach, have you? Or doing nothing? What have you done?
No, I was working long weekend in Madrid.
How many cases did you do?
35 cases this weekend.
So tell what cases have you done? So you've done...
Well, we did sympathectomies, lobectomies, segmentectomies, a variety of procedures.
Okay, so you'll have a quieter day tomorrow, right?
Yes, tomorrow I have to work again in Madrid.
Yeah. So you're in Barcelona, you're flying to Madrid.
Yes.
You're doing a case, and then you're flying back here.
Yes, because we have a masterclass in Uniportal Rats here tomorrow evening in Clinic Hospital.
Okay, so it's actually quite a quiet day for Diego. So just an average day, I guess.
Yeah.
And but what I really wanted to talk to you about was two things. First, you've just given a wonderful talk that we've actually recorded, so we'll put it up on CTSNet, all about this incredible new robot, SHURUI. So how much of a game changer is this going to be?
Well, I think it's the real game changer because this robot is based on new technology. It's called nitinol, which allows to get all the angles inside the chest, all the angulations, the most incredible movements you can achieve are with this robot.
So what is this? This is not using wires to move the arms?
Exactly. It's not cable-driven technology. It's based on nitinol, which is the technology of the tabis and the stents. So it's like metal that is heated and then can bend to every angle.
So they're like heating and cooling the arms to make them bend?
Exactly.
Really quickly?
Exactly. So there's no limitation inside the chest. That is the advantage with other cable-driven robots. And I think this is why it's a real robot we are looking for Uniportal. So this is the concept of Uniportal pure robot that we are looking for.
Yeah, and what are the main amazing things about it? I mean, the angulation around looks fantastic. It's quite small as well. Exactly. It works very close to the port.
Exactly, and there is also shorter distance to start working compared with other platforms, SP platforms, because only with 7 centimeters you can start opening the arms, and other platforms need more than 10 centimeters to start open the arms.
So you can basically put it do you just go a couple of spaces lower than a VATS, a uniportal VATS?
Exactly.
And then you're straight on, can do anything?
Absolutely.
Yeah. Wow,
it's really amazing.
And how many cases have you done so far or seen, or do you know how many's been done?
Yes, we did a clinical trial in China. I did the first cases with the Professor He Jinsen in Guangzhou last year, in December. But that was like lobes, lobectomies and segmentectomies. And then last month, we did another clinical trial in another city, in another hospital where I collaborate with them. It's the Suzhou University Hospital, one of the best in China. And we did the first sleeves. I did 2 sleeves. I wanted to check the limits of the robot, if it's possible to do complex cases, because we already show the feasibility for normal cases, and now the next step will be, is it possible to do a sleeve or complex cases where you need to do, more dissection, more movements, and absolutely, it worked very well. We did 2 cases right after the sleeve in a big tumor with no complications, with no limitations, and then we did a right lower sleeve in another central tumor, and it was amazing. So I'm really happy with the robot because now we can see that everything is possible.
So it's done like 100 cases, is it? Or how many has SHURUI done, do you think?
No, we did less because the clinical trial was, the first clinical trial was with 35 cases, and now we did already 10 or 15 cases with it. We are going to continue with more, but and then it's about now getting the CE mark. That probably next year will be ready. So I think maybe in 2025 we will have the robot in Europe. I think.
Wow.
Let's see.
That's great.
So
well,
it's
good.
Fantastic. It's good because we need competition. We need more platforms, and we need more development.
And do you know if they're looking towards America, or is that more difficult with FDA, or no idea?
It will come for sure, but it will need time. Robotics is always slow.
Yeah, but it gets there. It's the future, as you say.
It's the future.
Yeah. And I guess the other really big thing we want to talk about is Monday, the 17th of June. It's going to be a very big day. So we'll be there. We'll be covering it with CTSNet. And tell us what's going to be happening on that very special day.
Well, we are going to do the first missions with my mobile unit, the mobile unit with my foundation that is created for do minimally invasive thoracic surgery in a mobile unit in Africa. So this is going to be something historical for the first time, never done before, that minimal invasive cases are going to be performed in a mobile unit, moving from one country to another country, especially in the worst places for in the other not developed places. And I think Africa is a good place for this because
And a lot of us don't have any experience of thoracic surgery in Africa, but of course you've been to huge numbers of countries, Tanzania, Kenya, all sorts of places. So what is the need out there? Tell us, the type of person that just can't get surgery and what they really need out there.
The first is the equipment, because they have no equipment, no good equipment. So they don't have good cameras, they don't have the staplers, they don't have instruments. So there is a limitation to develop the minimal invasive surgery there, absolutely, because of with no cameras, with no equipment, you cannot do cases. And another limitation is sometimes, for example, there are problems with the light, with the electricity, switch off in the middle of the operation, so you have a lot of problems. Also problems with the customs when you want to import some materials, they have a lot of regulation, a lot of problems. So in order to solve this, because I was many times in Africa, many countries, you mentioned Tanzania and Kenya, but Tanzania and Kenya are quite developed compared with Mali, Niger, and Sierra Leone, Liberia, And then what I met there is that not only lack of instruments, but also lack of drugs, chest tubes, drainage systems, even tubes for intubation. So in order to solve this problem and do not suffer as I did, we decided to create this mobile unit, which is a fully equipped hospital, mobile hospital, with all the requirements, like small ICU, sterilization room, 5G satellite system, solar panels, batteries, and fully equipped OR with 4K, bronchoscopy, the most advanced anesthetic machine. So everything ready to have the best OR in Africa with our team. That means that we will bring our anesthesiologists, we will bring our nurses, and we will be with them. So we will replicate the same facilities as we have in our center, in the best hospital in Europe. So we will do the same operation there, because we don't need to be worried about the electricity. We don't need to be worried about, we have no staplers. We have all staplers, equipment, the best anesthesiologists, no problems with intubation. So that is what we want. To offer them ideal conditions to perform a good operation.
And I guess the other real advantage, you can bring their surgeons to watch, can't you, or train as well. So, because I guess that people will say, well, why do you use their hospitals? Why do you use their surgeons? Well, the answer is they can come to you and see what it should be like without all those problems.
Yes.
That seems so logical. Yeah.
So the first mission is going to be 17 and 18 in Ghana.
Yep. Mm-hmm.
And from there, we will move to Ivory Coast to do the second mission in the same week. But the first mission is going to be historical day 70 and 80. You will be there as well.
I will. Yeah,
and
absolutely.
I'm excited to see that this will be broadcast worldwide. So all thoracic surgeons will be connected in their countries to see what is happening there.
Great. And if people just wanted to help in any way whatsoever, should they go to your website to see if they can contribute, or how could people help if they're interested?
Absolutely. Everybody can contribute with the foundation. There's a website. They can go with the Diego Gonzalez Foundation, put in Google and you will go directly. Everybody can collaborate with donations, with also with help. They can come to do missions with us. We are opening this to all colleagues for missions in the future. Now, of course, the first mission we have to do it, but when the mobile unit start to work, start to move, from one country to another country, and we will see that it's feasible and there's no problems, because now we do the first mission in June. The second mission will be in August, from 5 to 9, will be in Sierra Leone and Liberia. So after these two countries, again, we'll schedule the next mission, and we will open to other colleagues to come and to also do operations, because the mobile unit need to be working. I cannot be in Africa all the year. So we want that all the colleagues will go there, use the mobile unit, do operations, because everything will be for the benefit of the patients, to help more people in Africa. That's the idea of the intervention.
Yeah, well, I think it's a wonderful intervention. It's absolutely fantastic. So, yeah, really looking forward to it. It's just literally visionary. Once again, a visionary thing from yourself.
Happy.
So,
I'm happy
great
to
job.
contribute to the thoracic surgery
Great. And
community.
we'll see how we get on. So, great. Great to
course.
see you.
See you in
Thanks a
June.
lot.
Huh?
See you in June. Yeah, great.